Welcome to New York Nonprofit Media. I'm Jeff Stein, and I'm here in the CEO corner with Doug Wirth, who is the president and CEO of Amida Care. It's the largest special needs health plan in New York State, and you are obviously a healthcare policy leader with experience in the Giuliani and Dinkins administration as well. So we're really pleased to have you here to talk a little bit about Amida Care's unique model.
Thanks, Jeff. I'm happy to be here.
So maybe if we could start by just hearing a little bit about what makes Amida Care unique, and also the philosophy of inclusion, reaching out to marginalized minorities, HIV positive community. I know that you've done a lot of work with that community specifically. Why is it so important to bring those communities into the fold?
I think fundamentally my own philosophy and the philosophy of our sponsors who started the health plan is that healthcare is a right, not a privilege, and that we have a duty as a health plan to do more than tell people to go to the doctor's office and take their pills on time. That we have an obligation to contribute more to the equation of wellness than simple reminder letters or phone calls. And so our community health center sponsors, providers, banded together back in the late 90s when Medicaid managed care was being tested as a pilot, actually the Southwest Brooklyn demonstration project that led to extensive managed care for people with Medicaid, largely moms and kids. And at that time, the AIDS community actually and the behavioral health community bonded together and said to the government, people with chronic conditions should be exempted from mandatory managed care, meaning they should be able to keep their Medicaid card and go anywhere that accepts Medicaid. At the same time that we won that battle, actually going back to Governor Mario Cuomo, we actually began work with government to partner in a public-private partnership to think about how to build a special model, a special health plan model for people with chronic conditions. And the special needs program, HIV special needs program, grew out of that philosophy. And the AIDS Institute actually played a leadership role in organizing the HIV community to build a better model for people living with multiple chronic conditions.
Great. Well, I know another marginalized community that has obviously been in the news a lot lately is the homeless community, and I know that you personally have a lot of experience serving that population. It would be great to get your thoughts on where you think the healthcare industry needs to play a role in helping that population.
Well, the first thing I would say is that actually housing is healthcare. And I think that that is something that the federal government has a hard time wrapping their heads around. So in New York, what we've been doing is thinking about how to build affordable housing and provide supplemental rental assistance for people who are poor, living with HIV, serious mental illness, and substance use disorders. My particular background of actually running homeless shelters in the Midwest really taught me a lot about the need to make healthcare accessible. And so for people who are in the shelter system or maybe moving from place to place, you really need to make healthcare accessible. One of the tenets of Medicaid managed care is that you choose a primary care provider, one doctor or a nurse practitioner, who you see on an ongoing basis. But we mentioned if you live in Brooklyn and then suddenly you're in a shelter in Brooklyn and now there's an appropriate supported apartment for you in Upper Manhattan, the managed care industry has to be able to rapidly move and make sure that healthcare follows the person, not putting barriers like waiting until the next month for somebody to change their PCP from Brooklyn to Manhattan. That creates gaps in care. And so I think the health plan industry has a responsibility to partner with homeless service providers to actually modify what we do to make it work for people.
Great. So obviously we're coming up on the new year, and it's a time when a lot of larger organizations are sort of putting their heads together and thinking about what are our big policy pushes for the upcoming year. Where does Amida Care see the organization going in terms of advocacy for the upcoming year?
Well, the special needs model, health plan model, is actually in downstate New York. Governor Cuomo actually took a courageous, bold move to advance a blueprint and a plan to end the AIDS epidemic in New York State. And so as we think about what we need to do to actually end the epidemic, which means there's about 3,000 new HIV infections statewide, we need to bring that down below 750 to actually end the epidemic nature of HIV disease. And so what that looks like to me is we need to make sure that everybody has access to medications. HIV is manageable. Hepatitis C, which is a significant issue among poor people, people of color, Hep C is actually now treatable. It's curable. So we need to actually make the care and services, medications, accessible to people. And then we need to work to remove whatever the barriers are that get in the way of people getting care. So for us, that's advancing pre-exposure prophylaxis treatment. Prevention. Treatment is prevention. So there are medications that are available to people to actually prevent the transmission of HIV. For every one transmission that we prevent, we save lifetime costs of $500,000. Medicaid and Medicare are the largest payer of those services. So investing in treatment as prevention actually saves taxpayers money, helps people be well and get about the business of living their lives. It's sound public policy.
Right. I would love to get your thoughts on collaboration between government and larger nonprofit organizations. You know, obviously the political process can be messy, but getting those two large actors to work together in as seamless a way as possible is really in the best interest of the entire community. You know, what have you learned over the years about how to make that process more seamless?
Well, I think it's important to know when to organize. So a good offense is often the best defense, right? So setting the stage and the context for what's the win-win. So in New York, we've been focusing a lot on driving down Medicaid costs. And so one of, I think, the current public policy challenges we face is how do we take some of the savings that we save from helping people to be well, lowering Medicaid costs, and redirect some of those savings, not just to take them out of the budget, but to actually invest in the other things that people need. So housing is a key example. Investing in affordable, livable, safe housing for people with chronic conditions is critical to both good public policy, it's important to community wellness, and it ultimately saves taxpayers money. So I think that what I've learned is that you want to organize, you need to actually have everybody at the table. Consumers, family members, providers, and government to actually work in the same direction. That's often, just getting people to the table is critical. That's one of the things that I think Governor Cuomo did well when he created the End AIDS Task Force. He brought those players together, and in less than 4 months, we created a blueprint with many, many recommendations about how to end the epidemic. Now we need to fund the blueprint. The governor's plan is doable. It requires investments from the state, and it's going to require investments from the city as well.
Great. Maybe as a final question, I always love asking people who are in charge of larger organizations about their leadership and management philosophy. What are the biggest challenges that you find, and how do you approach the job?
Wow. I think that the demands are great, and so the time management, prioritization is critical. But foundational to, I think, being a good leader is you need to listen to people. And so as our organization has grown, how do I stay connected to people on the very front line who are engaging? We've got health navigators and community outreach workers, finding members who have dropped out of care and actually walking them back into care before they get sick and end up in the hospital. That often is a little confusing. It's like a member's a knock on the door and the worker says, "I'm here from your health plan." And people are often like, "You're here from my health plan? Why?" And the truth underneath it is when people are not getting care and services, those are the people that I worry about. Those are the people who will get sick, end up in the emergency room, get admitted to the hospital, and they're also more likely to transmit HIV. So I need to talk to those CHOWs and those health navigators to understand what their experience is so that we can work with providers to actually transform the system. And I would say that ultimately need to put primary care, mental health, and addiction services together in a one-stop shop where people can tell their story and their challenges once, and then the healthcare facility has the responsibility to make that available to each of the players. But to achieve that kind of transformation, we actually need to listen to people with chronic conditions like HIV, serious mental illness, substance use disorders. We need to talk with the people on the front line about what's the difference that makes the difference for people to get care and services. 94% of our members are in regular outpatient services. 70% have undetectable viral loads. We are actually proving that if you spend more money on outpatient services, that you actually save more money on hospitalizations and long-term care services. If we're going to fundamentally change the way healthcare is delivered in this country, we need to do those things across the board in Medicaid, in Medicare, in the health exchanges, and it's a great opportunity. We can do this. It's not rocket science. We just have to invest the time, money, and effort and listen to the right people to create the change.
Great. Well, thanks so much for coming in and sharing all of those goals with us.
Thanks, Jeff.